Good evening, good evening, good evening. Welcome to the Caring View, the only online social care chat show available each week on YouTube. As you will notice tonight, I am not joined by my co-host Mark. He is fine, he is well, he is recovering. All the well wishes have been completely welcome, and he sends his thank yous to you. So it is just myself and our guest tonight, Caroline. So before we get started, don't forget to hit that subscribe button. Make sure you hit that bell, and you'll be notified of any uploads that we have going on. And if you've got any questions, please put them into the chat box. Anything we discuss tonight is going to be of our own views and not the companies we represent. I can say that Caroline is her own company. So good evening, Caroline. How are you?
Hi, Adam. Nice to see you again. 12 months later,
honestly,
pretty much.
Isn't it? I mean, for those who don't know, the Caring View happened. It's been almost a year since we started the Caring View. Prior to the Caring View, I'd ventured into interviewing and documenting stories as part of the COVID care stories. And Caroline, you were one of my guests on the COVID the care stories 12 months ago, and it's just great to be able to have this opportunity tonight to catch up, see what's been going on this last 12 months, and really just hear what it's like to be on the front line at the moment. Before we get into that though, there are a couple of changes to social care that people need to be aware of. So one that probably won't affect you as much, Caroline, with home care, but does for a lot of people, is the changes to visiting guidance in care homes. So for those who aren't aware, and one of them was myself, because I've had my head buried deep in reports at the moment, is all the COVID visiting guidance for care homes have been withdrawn. I did a quick check today to see what was going on. All withdrawn. There is no official one-piece guidance for care home visiting anymore. So the only reference to care home visiting is within the testing guidance for adult social care settings. And within that guidance itself, it now says there should be no restrictions to people leaving or entering care homes. That's it. No mention of risk assessments, no mention of impact assessments. Basically, there should be no restrictions anymore to visiting people in care homes. So if you are watching this tonight and you're still experiencing restrictions in visiting, I would love to hear from you. I'd love to know what's actually going on. It's easy for me to say nowadays because I'm no longer a care home manager, but I've been waiting for this day for them to actually go, actually, do you know what? Open your doors. People have the right to be with their loved ones. Yes, testing throws a spanner in that works, and we're no longer expecting relatives to test. And I am hearing some managers are still having testing as a condition of visiting, but that cost then can't be put on to relatives visiting. So it's going to be interesting to see what happens over the next couple of weeks, especially with the surge in cases that we're experiencing. But for me, this is good news. I just hope it translates into the world of being able to access your loved one in care homes. So if you're not able to, please let me know. I'd love to have a conversation with you and to see how I can help you further, whether that be on the show or just in private and giving advice and guidance. But like I say, the visiting guidance is now part of the adult social care testing. So Caroline, adult social care testing in the care workforce, how does it work now? Because if I get COVID, if I didn't have an ounce of respect for my society, I could walk out my front door, go to the shops, pick up a pint of milk and come home knowing full well I had COVID. Is that the same for social care? Can someone who tests positive just go and work in the community in social care?
No, the guidance is, and I believe we are in line with residential now. We've always been very different in terms of our requirements. So now we've dropped the daily lateral flow testing before shift, and it's down to 2 days a week, 3 to 4 days apart. And if people were to work part-time 2 days a week, they would need to test on both those 2 days prior to shift. If another big change, because this affected me a few weeks ago, a new change as well, is if you're a contact of COVID, so somebody in your household tests positive, you would have had to isolate, get a negative PCR and potentially return to the workplace. But as we all know, that's only good at that moment in time, that test. So now if you're a contact, you continue to come to work as long as you are tested negative, but you need to test every day for the 10-day or so period whilst that contact is experiencing symptoms and they themselves are positive, just to make sure you don't get it, and then obviously bring it into the workplace. So that's how that's working, and we're able to order the tests, because I know there's been different things on COVID groups, etc. How do I get test kits? And I'm not sure that NHS staff are that well supported with getting them, to be honest, from speaking to colleagues of mine that work in health. But in social care, we can order them through gov.uk, and I put an order in on the 13th of March, I think, just to make sure that we were okay. But yeah, so we can order lateral flow test kits to support staff.
We'll touch on the health shortly, because Caroline is one of my favourite people on this entire planet. I think what you do, Caroline's amazing on all of the work that you do, and we'll touch upon your health work shortly. But I know back from when I was a manager, there was funding in place, there was COVID grants, there was workforce grants, IPC grants, and all of that, so that if someone did contract COVID and they went off work, we could then pay them their full salary to make sure that they weren't out of pocket, they weren't out of money. We all know that the government grants have stopped for people who test positive in the community anyway. Are those funds still available for you as an employer, as a provider?
No. So the last lot of funding ended on the 31st of March. If I'm really honest, Adam, and speaking to other providers, they've experienced the same as me. Yes, we have had funding, but it's not covered all our costs. So when you are playing by the rules, you are paying staff the isolation wages, you're paying for additional cleaning, you're paying for potentially agency staff, etc., etc. I mean, we've been using taxis for the last 2 years for non-drivers, so they're not having to use public transport. That's been a huge expense, thousands plural per month on taxis, because we're domiciliary, we're community based, and when you add all that up, we're well over what we've ever received in terms of funding. So no, when I've spoken again to other providers, they stopped the isolation pay quite some time ago, to be honest, but I've only just stopped at the end of March. So now any staff member, and that's the worry, isn't it? You've got staff isolating away from work, not necessarily isolating at home, because like you've just said, they legally don't have to. If they're going to end up on an SSP, which if anybody's ever fallen ill and relied on SSP, it is negligible what you get. You're going to potentially have staff coming to work. Now, will that happen in our team? I'd like to think not. We've got a good team. They've complied with all the testing so far, but we've got to, look after them as best we can to help retain our workforce. And if they are going to end up short, then we're going to have to look at ways around that for them. Yeah,
and people need to put food on the table. I'm fortunate to not be in a position, and I suppose that's because I put comfort over food, that I will put the heating on in my house. But I'm speaking to people at the moment who are petrified of putting their heating on because of the rise of bills and the rise of the cost of living. So couple that with not earning a wage because you can contract COVID, then there is that risk and that fear that people will put themselves over the people we're supporting, which, you have to sort of understand. But things are getting better. COVID's over. Morrison's down the road from me have taken away all their plastic barriers. You don't have to test anywhere nowadays. We don't have to test in the public anymore. So things are getting better, aren't they, Caroline?
Well, it's just so difficult. Health and social care, it is really difficult because all the requirements are still there. Our staff are still wearing full PPE. Yes, okay, there's a little bit of relaxation in terms of eye protection and some relaxation around gloves and aprons dependent on tasks, but generally speaking, they're wearing full PPE still. We did relax it in vehicles a bit ago because if they're spending a long shift, sometimes it could be 15-hour shifts, in a car with another person wearing either full PPE, which we were doing in a car at one point for Test Track and Trace, or the face mask, they're struggling to eat, they're struggling to drink, just having that air to your face. So we dropped that when we were testing daily, because I thought, well, okay, if 2 staff come to work, they've tested negative that morning, the risk is negligible. But again, that risk is increasing because people are mixing. And let's face it, Adam, after the last couple of years of isolation, not able to see family, not able to see friends, not able to go away, for mental health or mental well-being, people have got to go and live, haven't they? And then you're mixing with other people, you are increasing your chances of transmitting COVID. And so the risk is really real, and it's still impacting us massively with staff isolating. I don't know that we really had any significant period of time without somebody isolating, and that has a further strain on normal sickness as such, or usual sickness, annual leave, and then a shortage in the sector anyway of staff. It's just the pressures are continuing to press down, if I'm honest.
Yeah, and obviously I say COVID's over in jest. I do believe, as much as, you know, it's going to be with us forever, I believe the flu's with us forever. I think it's how we manage and how we monitor it now. I do worry, though, especially with Shanghai going on to super lockdowns at the moment and all these other countries implementing these restrictions, the fact that our Prime Minister and ex-Secretary of State for Health and Social Care have both been fined, or is it our Chancellor have been fined for breaking their own guidance and their own laws, that this idea of freedom is being used to sugarcoat people and going, but don't worry, the Tories have brought us to this place where we can be free and there's freedom and we're free again. I mean, Carl's brought up a good point in the comments, and you know, it's how do we support those dealing with disabilities and what does it mean for them? And I think that really does apply for anyone who's CEV in the community, anybody who we're supporting. How do we reassure them? How do you reassure them, Caroline, that look, we understand what's going on in the world now. We understand people can go and do what they want and be free and everything. How do you still put that message to them that you're doing the most you can to support them?
So I've not changed anything since day one, Adam. We have followed Public Health England, the World Health Organization regulations, requirements. We have followed all of that, the guidelines from day one, and we will continue to do so. You've got to risk assess every situation. You know, when you've got short staffing and then COVID on top of it, you've got to balance, haven't you? Because you've got to provide staff to care for clients, or you're cancelling care visits, which is not good in many ways, and safeguarding being one. So it is a real balance. So we risk assess each situation because everybody's different. You know, for example, the other week, my partner tested positive and I moved out of the house. So I kept being able to go to work because I know I can't have time off work at the moment. So it's looking at that and discussing with staff, what are your options? And if people live in small flats or they don't have separate bathrooms, that's really difficult for them to keep separate if a partner, loved one, family member tests positive. I just have to reiterate to people, we are following the guidelines. Staff are wearing the PPE. We, throughout COVID, did sort of 3 monthly group sessions training on donning and doffing PPE, so putting on, taking off safely, hand washing, just to keep reiterating that message. And we will continue to do that on a regular basis, not quarterly, I wouldn't have thought now, but probably every 6 months, just to reiterate that to staff teams about the importance.
Yeah, I mean, Amanda's brought up a good point now, and the fact that not everyone is frail or older or clinically compromised, but the restrictions are the same for everyone. And this is something that's really irked me. It's been an ick of mine throughout the entire pandemic, that you could have an establishment where you're supporting people and they could be with full capacity, not clinically vulnerable, not immuno at risk, and yet the same restrictions were applying to everybody. So surely there's got to be a way we can move forwards now without having this sort of protective blanket upon everybody and restricting them from their own life decisions, their own life choices. Next week, we've got a show literally all around positive risk taking. And I'm a firm believer about person-centered care. It's lovely, it's nice, it's an idea. I'm more about person-led care. And there has to be a point where we can get to now where we actually allow people to make those decisions and we run our risk assessments around them instead of making them fit within our own risk assessments. Look, we could spend all night talking about COVID, and if I'm honest, it would depress me because it's all we've done for the last 2 years. And I know, Caroline, you've done some amazing stuff this last 12 months. But before we get into some of the stuff that you have achieved and you have done and you're still doing, I want to know about your other role, because people pretty much think you either work in health or you work in social care, and there's this barrier between the two. The two neighbours that don't get on, you know, and if you look over someone else's fence, they're going to tell you off. Yeah, it doesn't work, it doesn't mesh. You know, we've got the Green Heart for Social Care campaign. The NHS have got the Blue Heart for Social Care campaign. I believe the two hearts fit together perfectly, because we do. But you're living proof of this. So tell us about your health role.
So let me go back. So as a child, I grew up, and I say to people in the care sector, and I need to be really careful how people interpret that. So I was brought up by my parents who had a residential home. So grew up with umpteen, I lost count, of grandmas, granddads, the best upbringing you could really ever imagine. Learning that people are people, they are individuals, they have had a life, they have gone through all the stuff you're experiencing, all the things you're going to experience in the future years. And it was just the best. And as I say, I was a child when they bought the rest home, and grew up with that and did every job in that building, from weekend cleaning, sort of sulking a bit because my friends were out playing, to cooking, to care assistant ultimately, and then senior, and went through the CQC process for registered manager, and then joined North West Ambulance Service, I think 19 years ago, or it'll be 19 years in September, and I did the old-fashioned route as such into the ambulance service, so I became a technician, and then 2 years later I did my paramedic course, and all of that was in-house training. So I've worked for NWAS for the last 19 years, and we set up the domiciliary care business 9 years ago. So the parents sold the rest home, and I set the domiciliary care business up, and my mum's registered manager for the business. I continue to work alongside that as a paramedic, and then gradually over the years reduced my hours down to a part-time basis, and then literally on the 2nd of February 2020, I handed my notice in at NWAS because I just couldn't cope with the two anymore. The work-life balance I've never found, still haven't found it, still looking for it desperately, and I just couldn't continue anymore. And my partner and I discussed this, and big decision, but handed my notice in to go on bank. Now, if you think, the 2nd of February 2020, I didn't have a clue what was coming, and it was just it was just uncanny in terms of timing, and it left me with a mixture of emotions, because I still see my colleagues when I managed to go in and do my shifts, which I am struggling with at the minute because of all the pressures in social care, but the guilt that I've left my colleagues fighting this virus that we didn't know anything about initially was awful. So health paramedic pre-hospital hat, and obviously a good amount of sort of social care experience, and they do work hand in hand, Adam, and it really frustrates me that when you talk to people, it's very much Department of Health, and this is my view, but Department of Health, don't forget social care, and it's really frustrating, because if we work better together, we're going to get better outcomes for everybody. I try and use that pre-hospital hat. So when we set the business up, I was adamant we had a full service that we managed ourselves. So we've got a robust falls policy. It's worked brilliantly for 9 years. So care providers that say our staff aren't medically trained, insurance won't cover this, and we can't possibly look at this. I challenge them every day, to be honest, because I've used our policy for 9 years. Yes, it's been developed. Yes, it's evolved. Yes, okay, I've used my paramedic knowledge putting that policy together, but it's not failed as yet. And then last year we upskilled the senior staff to complete baseline observations to calculate the NEWS2 score, because we all know ringing up, and this is no criticism to health because they've got their own issues, but trying to ring your GP up and get an appointment, ringing up 111 can be time consuming, ringing 999 at the minute if you're not high priority, there's a long delay often, and really that is no criticism. So I thought, well, if we upskill staff and they can complete baseline OBS and calculate the News 2 score, they can at least forward that on to the GP or 999 to say, look, we've completed the OBS, these are the OBS, and this is the News 2 score, and it'll further help that triage process, hopefully getting our clients a better, more efficient response.
I mean, it's spot on, really, because we look at social care as a sector, and I'm pushing a number of agendas at the moment. And for me, social care isn't a sector on its own. Social care is community, it's society, it's everybody who lives and breathes in this country are part of social care. Social care businesses support the delivery of social care specific services, and those social care specific services provide a foundation for the NHS. We allow the NHS to be able to function. So the fact that you've managed to upskill your teams, and instead of wasting that time of a receptionist or a triage nurse or the doctor going, what's the blood pressure, what's the pulse, and keeping them on the phone when they could answer to somebody else, you've gone, this is the BP, this is the RESPs, this is the SpO2s, this is what's going on, this is all the information you're going to need and that you're going to ask me for. You're helping them move further, and it really must provide some sort of professional identity, some sort of boosted morale for your team as well.
Yeah, the seniors have enjoyed that. I think it all comes back to training. If you provide your staff with the good training, the support, they will run with most things, to be fair, and you will know that from leading a social care team. They know that that's going to have a beneficial impact on their clients, and they will run with it. And they've all absolutely lapped up the training. They're really happy to have their kit, they carry it around with them. And this year we are hoping to upskill the care team. Now that won't be everybody. There'll be some people that want to shy away from it. It's not for me, and that's fine. But there'll be some people that are, I'll do it, And if we can train them up, we can again kit them up with the kits, and get more and more people completing these OBS, because we look for soft signs of illness, don't we? Soft signs of infection or sepsis. Or if we can look at, and we're not having to do manual BPs, with a stethoscope, etc. It is literally a BP machine that you can buy at Boots or wherever. Anybody, any Tom, Dick and Harry can use a BP machine at home. So why can't care staff? The SATS probe, literally putting it on somebody's finger, the thermometer, we've all been doing that during COVID. So they're not really doing anything they're not capable of doing. And it's helped massively. It's helped several times now. Getting that more effective response and keeping people out of hospital, to be honest, Adam.
There's something around there being a hierarchical sort of ego, though, in all of this, isn't there? Because, like Amanda said in the comments, their health colleagues need to work with them to promote better health outcomes. They've got a clinical policy in place, but what they're finding is, many CCGs are reluctant to engage and follow formal processes. And from my understanding, and this is probably just my opinion, so I'll go back to the beginning of the show. These opinions are of our own and not who we represent. There is something around a fear of providing social care teams with professional tasks and them not being qualified enough to do it. And actually, I'm a nurse, I should do it. Or I'm a GP, I should do it. Or I'm an NHS trained HCA, I should do it. When actually we should be looking at our social care teams and going, you can do all of this if you're trained and there's competency assessments in place. It's going to benefit us. June, July this year, we're looking at a fully integrated ICS push from the government throughout the country. I don't think it's going to happen. I've spoken to some ICSs who are in dire states at the moment and aren't anywhere near having enough regulated providers on board. We're lucky we're in Lancashire and our ICS is probably a few steps ahead of other people's, but there are many out there who aren't doing it. So how would you, as Joni Mitchell would say, you've looked at things from both sides now, how would you approach our health colleagues and go, look, we are social care, we're not, university trained, and I can hear nurses from pre-19 whatever shuddering at the moment, going, oh, you didn't need to go to university to be a nurse. How do we communicate with our health colleagues and go, look, trust us, we can do this now, we can support you?
think we've got a lot of barriers to break down, Adam. We, as you know, have been supporting a cohort of T-level students from our local college since October last year, and I've got involved with the regional T-level meetings and had a conversation, and I won't name the trust, but I've had a conversation with our local hospital trust to say, look, you're getting our cohort of students after us, can we at least have a conversation to say, okay, this is the training that these students have completed. They've done an awful lot with us in 6 months. Some of the students, bear in mind they only started college in September, were almost at the point of becoming that second carer on a double up. You think that's quite a transformation. 1 shift a week as well, not full-time working. So I had that conversation to say, look, can we not meet up and discuss, this is what our students have done, we've got them ready for you now to take on, and not get them to complete the same training again. And so you know where they're coming in, that they can don and doff PPE really proficiently because they've been doing it with our care team for 6 months. And if I'm honest, Adam, the conversation fell a bit on deaf ears. And when I've unpacked that with somebody else, they said, you know what, Caroline, people don't understand social care. And that's the problem. And I think we've got all these barriers that we need to move out of the way to clear the path. So I think we need to be educating people about the social care sector, which is what you're doing, I'm doing in my own way, getting involved with high school, college, talking to students, because you know what, when we completed last week an end placement review with students, I saw 6 of the students, 2 couldn't come in, and I had the conversation with them. What have you learned? What key things are you going to take away? And then just give me one thing that you're going to take forward now. And we asked also, has it changed your perception of social care? And they said, yeah, absolutely. We didn't know you did half of the things that you do. Now, these are 16, 17-year-old students who are on a health and social care programme. And you know, up until recently, really, in the last year, who had really heard about and understood what domiciliary care is?
Well, I mean, there's so much to take in at this moment in time. I mean, you know, when I said you look at things from both sides now, I'm meaning you've looked at health and social from both sides of the fence. But Carl brought up a really good point, the fact that actually we're not, you know, service users, residents, people using care and patients. And, you know, there has to be a point where we go, integrated care services, great, you know, wonderful. Health and social care are all at the same table. But there has to be a seat, multiple seats, more seats than everybody else pulled up for people who are using services and drawing on services. And we need to start listening to them now as well, don't we? And going, actually, what do you want your care outcomes to be? What do you want to see moving forwards? We'll touch on person-led care later on, but I just want to go back to this whole school thing, because besides working bank for NWAS, besides running your own home care company and being on the front line every single day at the moment, battling COVID and making sure that the people you support are provided the care and support they need, you're also piloting, trialing volunteer schemes. You're trying to get people into social care, and you're looking at the recruitment aspects as well. So COVID aside, we know that's affected social care recruitment. It's been an issue for a while. The workforce has been depleting. We're an aging workforce. We understand that. What are you trying to do now in Lancashire, in your little area? What are you trying to do now to improve that?
So we've been working with Skills for Care, who have been fabulous, to be fair. We've had some sessions one-to-one. I've attended different things, and we're looking at how we do recruit. Because historically, Adam, and you'll have done this, as most providers have, you go to the job centre, you go on a job board, whatever you do, and you advertise domiciliary care assistant or whatever the role title is, and you put hourly rate, and then you put in, this is your job description, so bang 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 in bullet points, and then your benefits at the bottom. And actually, we're not selling the role really, and it was only really when somebody clearly pointed that out to me. And looking at our social media as well, what we put out there, we do an awful lot of good stuff. But let's face it, Adam, I wasn't brought up with a mobile phone. I wasn't brought up on social media. All that tweeting, that's the selfie mode. I didn't know how to do a selfie years ago. I thought you had to turn your phone the other way around and then try and. How on earth are people getting these selfies? And somebody said, "Well, you just press the thing that." Anyway, so you've got to put all this out. This is what we are doing. This is what we're celebrating. And whatever we do, I try and look at it. Going back to was it Carl's comment? I do try and look at it from every perspective, and I review absolutely everything. So when we complete training, when we the Employee of the Quarter award was a really good example here. I don't try and just tick boxes. We could all do that every day, couldn't we? Tick the box, we've done it, put it away, file it. But is it actually having an impact on the end user, whoever that may be? And we have those conversations, and throughout COVID, I've probably done more of that. Engage with regular email updates, phone calls, letters, updates. These are the actually saying these are the challenges that we've got, rather than actually burying them. We are struggling. These are our challenges. This is what we're doing about it. This is what we're trying to do to improve the situation. And I've lost my train of thought now. I knew I would. I do this all the time, as staff will tell you. So going back, I do try and look at everything and okay, is it having a beneficial effect in the end? And I'll just, the Employee of the Quarter award, we have actually had a real good uptake with recruitment recently, following the advice we've had. And I'll touch on that in a second, but I've talked to a couple of people. I had a chap coming for an interview, and bless him, he waited 10 minutes for me. One of those afternoons where everything's going on. Can I just? Yes. And I said, can you just bear with me? And he saw me giving these awards out and flowers and all. And I apologised to him afterwards and explained it's our Employee of the Quarter award, and told him what we do. And I said it took 4 years to get to this. Now, most people in a company have an Employee of whatever award, don't they? It took me 4 years because I wasn't comfortable that it wasn't going to be the traditional tick box exercise. Oh, we haven't done it this month. Who can we nominate? Oh, we'll give it them. So we've got a panel with a client and 2 relatives on. Our training assessor from Training Works, who we use, Mel, who heads up our social media, and myself. Now, I'm not involved in the process. It's only Mel who knows who's been nominated and who's nominating. We all get an anonymous sheet. We look at, okay, what are the nominations this month? And we all collectively agree who will win and who are the runners up. And the prizes are great. Even though I say so myself, an engraved glass trophy, not just one of those little plastic egg cup things. Big bunch of flowers, voucher and things. And then the runners up get big bunches of flowers as well. And I was talking to somebody and they said, oh yeah, actually we just go on WhatsApp, who do you think it should be this month? And if Adam comes up 3 times, he'll get it, And I thought, I'm so glad I waited and I put the time in. And like I say, I try and look at how is it benefiting the end user. And going back to the recruitment, we've just changed it all, Adam. We're trying, one key message is to try and make your advert not only stand out, but whoever's reading and watching videos particularly, they need to feel something about your advert, about that job role. They need to feel and actually think, do you know what? I could do that. And that's what we're trying to do now, is change what we're doing and how we're doing it using case studies.
Yeah, there's definitely something around emotional intelligence here, isn't there? We're thinking, if I'm looking at a job role in social care and I'm thinking, oh, I'm going to go and do this job in social care, if I read this advert, would I want to put my mum in this place? Or would I think my mum would be comfortable living here, or my mum would be comfortable receiving these services? And that's what we should be going with, shouldn't it? Would I be comfortable someone else receiving these services because of what I'm feeling from this advert? Very much so. And I love your process on Employee of the Quarter. I've had conversations with people in the past who actually open themselves up for some sort of employment tribunals because of the way they run their Employees of the Month. It sounds trivial, but there has to be a quantifying nature to it. You can't just go and go, oh, yeah, this person's got it perfect, because you open yourself up to all sorts of troubles. So what are the main barriers right now? Recruitment, COVID, what have you. What are the main barriers you think are affecting social care right now?
Recruitment, which is caused by many issues. So the image of social care. Think about domiciliary care. You know, if you go and work in residential, you hang your coat and your bag up on the way in, you pick it up on your way out, you've done your shift. In domiciliary, you know, it's very different. We are funded per call. And let's face it, if it's a business, if you're not getting the money in, you can't pay it out. So we've done a few things where we can work towards, we're not there yet, but we will be at some point soon, working towards a shift basis for staff. They start at 7, they finish at 2, regardless of what gaps they've got in there, they'll be paid for the shift. So the image, the working conditions, if you want to put that under, if they're out of work 15 hours a day, they're only being paid for 10. Is that fair? No, I don't think it is.
And there's that fine balance, isn't there, so we want to make sure that our team get the hours that they need. We want to be flexible to them. We want to make sure that, you know, they can go and pick the kids up from school, or they can go to their Pilates class because that's what's beneficial to their mental health and well-being. And that's one hand. On the other hand, we're going, but you can choose the time that you want your support, and you can choose who you want to come and support you, and you do have the choice over your own care. And it's this really hard sort of scale of how do you find that equilibrium so that it benefits everybody. And usually we focus on one and not the other. But what I get from you is you're really focusing on the two of them, which I think is completely admirable.
It's really hard, isn't it? You are absolutely right. And I always say it is like scales, and it'll just tip one way, you need to tip it back. And it is constantly moving and changing. One other thing we're doing, we're sponsoring from abroad for recruitment.
How are you finding that?
Okay, good. But the Home Office are not the quickest. But let's face it, we've got the issues with Ukraine going on, which is holding up visa applications. So, yeah, we've got another 4 staff due to arrive with us. Hopefully by the end of April, but I think it's going to be delayed to probably May. But yeah, it's okay because we pay the going hourly rate as such. And if you're funded and you are solely reliant, which we're not, thankfully, but if you're solely reliant on local authority funding, we know you're not going to be able to pay that hourly rate because you're not, again, getting it in. So, yes, we can do that, and we're very lucky we can, but I know some companies can't.
I mean, the care model's changing at the moment, and some recent data from Langbusen have shown that there's actually a decline in the demand for residential care. So over the last sort of 5 years, the interest in demand for residential care is dipping. And there's actually an increase there is a slight increase in home care, so people are wanting more home care, but there's also a massive increase in supported living, extra housing, and other models of care. Do you think, and I don't want to make this too political, and I don't want to know which side of the fence you sit on, I just want an answer really. Brexit, you know, luckily we didn't rely on our European brethren to come and support our services, but the MAC report last year has shown how difficult recruitment's been post-Brexit, and overseas recruitment has now got to go through sponsorship for anybody who's not a UK national. Is that impacting us? Is that putting up a barrier to social care recruitment?
I think it is. I do. And I went to a Chamber of Commerce event where they were looking at Northwest research, and I was quite staggered that unemployment is only up by 1% prior to COVID. I can't remember when that was, whether it was either very early this year or very late last year. And it is Brexit that's really impacted, because we've had people leave our country to go back to other countries, or people are not coming over the same. Yeah, I do think it's impacting, if I'm honest, Adam. And there is no shortage of overseas workers wanting to come to the UK to work. We are inundated with CVs. Every day we get something in our email. And I've got a raft of emails or CVs still to go through. Yeah, I do think it is.
So, and again, I'm going to play devil's advocate now, but reassure me. So I'm looking for care and support. My family needs some care and support at home. I understand that you've not got many English workers and you're having to look for people who are abroad. reassure me on the quality. How do you measure that? How do you make sure that you're actually meeting the same standards that we need to when you're recruiting from abroad?
When you're recruiting workers from overseas, they are so passionate, they are so keen, they are so enthusiastic, they are so positive, they want to get in this country, they want to work. For whatever reason, you ask them for a document, you ask them for their documents, you ask them for whatever, it's in your inbox within sometimes seconds, minutes, days. You are not chasing them up. They're completing the care certificate online prior to coming over. They complete the mandatory training when they get here. They all come over with completing and passing their IELTS tests. Yes, there's different levels to IELTS, but they are good English speakers. We interview on Zoom, so I have that conversation. Is there going to be a language barrier? Is there something that we need to look at here? We look at what's behind their move, their reasons to move, and they are genuinely and generally really passionate, caring people who have been really, really successful and are really qualified. One of our workers came from the Philippines. He's got a physiotherapy background. I mean, that's amazing when you're working in social care, thinking about falls prevention and exercises. We've got a lady coming over from Nigeria. She was an emergency medical technician on the ambulance service, driving ambulances and taking people to hospital, in emergency situations. Now, if they are not great people to get involved in our sector, who are?
I mean, it's spot on. Absolutely spot on. I mean, I'm for anybody wanting to come and work in social care if it means making sure that we can support our most vulnerable and our most needy. I've just realised I haven't put my extension lights on, and I was quite cocky thinking it was going to stay nice and light this evening, and I've all of a sudden been descended into darkness. So I apologise to anybody watching who's seeing me in shadows. You brought up earlier one of the barriers to getting people into social care and the actual view of social care is the public perception. It's the public image of care. Now, I mean, we've known each other well over 12 months now, and you know the work that I'm doing to try and improve the public image of social care. But I need your opinion. How do we do it? How do we change it? Is it having a sort of sexy social care TV show like Casualty? I won't mention Holby City. I know that's a sore point for some people because it got cancelled recently. But do we need something like that that's nice and fictional and brings a positive light to it? Do we need more positive media stories? What do we need to do now to improve the public image of social care?
I think we need a range of things, Adam. Let's face it, bad news always sells news stories, doesn't it? Whether it was the old-fashioned newspapers. So we read all the bad stuff. That's told time and time again. How often do you read the good stuff? So yeah, we do need to showcase what good work goes on. There's good and bad of everybody and everything in life, in the world. But there are some fantastic providers who work hard every single day. We need to celebrate it. We need to celebrate the staff. I've said for a long time, 999, what's your emergency? I wouldn't go on that for all the tea in China. I just would not. That's not my cup of tea, thank you. However, look at what it's done. It's enabled people to understand the life of a frontline emergency worker, a paramedic, a technician, working for the ambulance services. So yeah, do we not need something like that? I'm not against it. Would people want that coming into their home? Potentially not. But yeah, I think we need to engage with it. I've said for a while now, I know somebody on a recent group said no, maybe not, but an influencer, we need to educate from young, don't we? And that's why I'm trying to get into the high schools, talking to school pupils. And I did that recently, and the response was phenomenal. Tried to make it engaging, had videos. I did activities with them where they put on weighted gloves to show them how poor dexterity can alter, just simple tasks. And then I put on a pair of goggles to influence sort of eyesight and perception when they were walking. And that went down really well. And they were quite engaging, the students. And I think they were quite surprised. Oh, actually, you can have a career in social care. Who would have known it? But equally, we need to be tapping into the parents, the support systems, because if they're going home and saying to mum, dad, whoever that may be, I want to become a care worker, we all know what a lot of responses are going to be. So we need to be having wider conversations, and even if it is just a stall in the local supermarket, to go, do you know what? Have you ever thought about a job in social care? We know the answers are probably going to be negative, but then challenge that. Can I just ask, why did you respond like that? What do you think about the role? Because unless we start having, again, those conversations, we're never going to break it.
Oh, totally. I mean, I remember when I first got into care, you're in a dead-end job. You're going to go nowhere. There's nothing you can do when you're in social care. Go to university and get a degree. Now look at me. And don't get me wrong, a lot of that's passion, a lot of that's dedication, good deal of luck. But there are so many pathways out there for people who join social care that I don't think people are aware. Even if you don't remain on the front line, you can become an educator, a teacher, you can become a writer, you can become anything. There's got to be something we can do. And I agree, we need to start influencing the younger years. And I think take it even earlier. I think we should be talking to our 4-year-olds, our 5-year-olds, and it all comes down to, the social taboos and stigmas. Oh, someone passed away, or they left us. I actually heard that once. Oh, they left us. No, they died. Yeah, they died, and we can't sugarcoat our youth from the morality and life that they're going to be facing and experiencing. And if we can do that at a younger age, and they can start thinking, oh, when I get older, I might have this condition, or, oh, that's probably why grandma's like that, or my cousin who was born with a disability and that's what they're going through. All ages are involved in social care. If we can get them really young and start making it a viable career from a young age, then that's going to have to benefit us moving forwards. Where do we go from here? So you're doing incredible work, absolutely incredible work. But what do we do now? What are the next steps in social care? What are the next steps for you at Clifton Care? Which, by the way, if anyone doesn't know, Clifton Care, where are you based, Caroline?
So, Lytham St Anne's.
Lytham St Anne's. Clifton Care, a fantastic care company. What's your current CQC rating?
Outstanding.
Oh, music to my ears. But where do you go now, Caroline? You're already at the top. So what do you do now moving forwards?
Well, and that's interesting, isn't it? Yes, we've got outstanding, but that doesn't mean to say we need to sit still. We need to continue improving. We need to continue evolving. We need to continue challenging the practice that we do every day. We need to continue going back to Carl's comment, looking at it from the end user point of view. Is it benefiting everybody, not just the clients, but staff as well? And for us, really now, it's about recruitment, upping our staffing levels, which we're doing. We've got about 10 starting at different times. Getting that staffing level back up again, easing the pressure off our current workforce, and then continuing with, because we do an awful lot of learning and development, continuing with that, the learning and development for people, so we support them through that career onto the level 5. Because if we don't get people trained up, who are then replacing the care managers, the registered managers that are looking to retire, and we need to plan for that, don't we? We need to continue to evolve and plan to backfill with knowledgeable staff who want to work in this sector, who are passionate. That's for me, that's what I'm looking now to do.
And with that, we need to look at succession planning, don't we? So we get somebody who joins our team, and I believe everyone who works in social care is a care professional. So when I say, the lowest ranked care professional, what I mean is the most brilliant person coming into a HCA role, which we have to admit is, say, the lowest in seniority in a role. There's no detriment about being in that role. But we need to look at them as the future leaders of tomorrow. So when they join our company, we need to see them as a manager at the end, or whatever they want to be when they join our company. So what do you want to achieve from social care? From day one, we're going to help you get there. And then in the instant that we say that to them, we then have to start planning for them no longer being with us. And we go, right, well, in 3-4 years' time, they really want to go run their own business, which is amazing. It's incredible. But I, in my head, need to know how I'm going to replace them in 4 years' time. And it's that continuous spur of giving people our knowledge, transferring of skills, and supporting people. That's only going to benefit us moving forwards, isn't it?
Yeah, absolutely. We want, and going back to your comment, how can you reassure people if you're recruiting from abroad that they're going to get trained English speaking care staff attending them? And yeah, absolutely, they want that reassurance. But that's how we're going to reassure them, if we're continuing to do that learning and development, if we're continuing to upskill, if we're looking at those young apprentices at 16, 17 coming through going, do you know what? I think we've got a senior here. We need to start working towards that. Is that something you want to aspire to? Because not everybody does. Some people want to come to work, enjoy the job they do. Let's face it, when you speak to care staff, they love their job. And if they want to come to work, love their job and go home, that's fine. But as long as you've got some staff in that team that want to go up that career ladder, you know, we've got, like you say, care assistant roles, senior care assistant roles, mentors within the team that can help junior staff who are maybe suffering with a bit of lack of confidence or just general experience. We've got the mentors, we've got the assistant managers who do more of the auditing type things, and then you've got the registered manager, you know, you've got the managing director of, like you say, an organisation. But don't forget, leading back into health, we are now doing more health prevention and sort of health strategy work, aren't we? We're educating people, falls prevention leads, safeguarding leads. I know our local authority have reduced or increased, should I say, the threshold to report to. So more is falling on a provider's shoulders now. Yeah. That's a recent change in March. So the things that you would have maybe reported some time ago, you won't necessarily report. So we are going to have to evolve roles so that people, not just the managing director or the registered manager, we've got people like safeguarding leads that will look at potential safeguardings and investigate and look at improvements and how we can prevent things happening again. System development, you know, we've not even touched that today, and we've nearly been on an hour, but how much digital advancement we've got now and how much that can feed into social care and support people to live independently, because it shouldn't be about providing care to or for somebody, it's providing care with an end goal for them in mind, isn't it? A strength-based approach.
Yeah, I mean, we talk about technology and we could probably talk for ages, and I know we're coming to the end now, but, you know, I always think to myself, all these sort of gadgets and gazmos that the council pay thousands and thousands and thousands of pounds for, and I remember way back when supporting somebody who'd been given a load of equipment from OT to help get their legs out of bed in the morning, and it didn't work. Anything they gave them didn't work, and they jerry-rigged a pulley system above their bed. They did it themselves. They got, you know, a hook and some cable and what have you. And every single morning they got themselves up out of bed using a jerry-rigged system that they developed themselves. And we need to start learning from real life experiences now. What do you do that benefits you, and how can we replicate that to benefit other people? So we're not going to put in this massive digital system in a massive box in your home. Will an Alexa work? Will a Google Home work?
Yeah.
You know, I'm not going to give you a Return 7500 if you're not going to use it. What equipment will work for you? And that's what I mean by person-led. We need to let them lead the decisions now moving forward and how they're going to benefit themselves. I mean, Caroline, I could talk to you all night long. I absolutely love speaking to you. I mean, we recognised you in our Advent Care Heroes before Christmas, and one of the people you support, I know, is setting up a great initiative in trying to reduce loneliness in the community. And there's just so much that you are doing. I just hope people who are watching tonight, who are listening, go, actually, I can take this away now and I can implement something similar in our area. I mean, I'm not going to try and give you extra work, but, you know, Caroline's Twitter is rolling across on the bottom of the page. If you do want to check out the website, it is here, cliftonhcl.co.uk. Please do get in touch with her if you want to. I know she's incredibly busy, but you're an inspiration to me. I mean, I remember right at the beginning of the pandemic, you said to me, and one thing we've done in domiciliary is just put bins in everybody's houses, so that actually there's a PPE disposal at everyone's door. And I sat there talking to you and I thought, how good's that? Proper simple. A proper simple solution which makes things a heck of a lot easier. There's less stress on the person we're supporting because we're filling their bins up with God knows how much PPE. brilliant. I took that away straight away and implemented it into my own service. I copied you. I'm not going to lie. I thought it was a fantastic idea. And that's what's needed now in social care, is that sharing of knowledge and peer support. Anything else before we go, Caroline, tonight?
I don't think so. Can I give a quick shout out to our mutual friend Bill? I think Bill's tuned in this evening. Bill's one of our local residents in our local area, and basically I met Bill through yourself, Adam. We've had a chat. He came to the office one evening when taking his dog for a walk, and he's a real advocate for social care. And going back to what we said, it probably ties in quite nicely. We need more Bills, because he shouts from rooftops. He goes on Twitter, he goes on Facebook, he challenges people in terms of their thoughts about social care, and he just cares about the sector. And it was all through COVID. He wasn't an advocate as such before, or certainly not a vocal one, but it was through COVID and saw the again, media coverage of social care workers. Thankfully we weren't in this boat, but not having PPE, going out and facing a potentially deadly virus, and it was through that he thought, hang on a minute, this is not right. And he's done loads of work. He's offered us bowling for our staff teams as a development, a team building evening, he's just an all-round great guy. So if he's listening, hi Bill, and we need more Bills.
Absolute big up to Bill, and I'm going to big up Carl as well. Why not? Carl joins us every single week, and Carl's a massive inspiration in social care. Carl's somebody who has drawn on the service, does draw on the service, and is a huge advocate. We love him at the Caring View, and he does so much on, like you say, social media to raise real awareness of going, actually listen to us. This is our voice. Listen to us for a change. And, to the Carls out there, to the Bills out there, we need more of you. Speak up. We're here to listen. There will be people out there who don't want to listen, and unfortunately those are the people that we don't need in social care anymore. We need people to listen to the Bills and Carls of the world. So no, absolutely fantastic. More than happy for a shout out. So next week we are joined by Mark Howe Senior of How To Training and Consultancy, and I'm really excited for this. It's a conversation around positive risk taking, which prior to the pandemic, everyone was getting used to. We were thinking about, is that a good risk to take? Should we risk assess that and stop people from doing that or not? Is it going to benefit their lives? COVID came along and completely washed it all away. It's like building a sandcastle on the beach and the tide coming in, it just disappeared. So I'm interested in next week's conversation. I know especially in community care, positive risk taking is a huge aspect of what we do. And we've got to make sure that all those risks are balanced with positive life outcomes. But we're at that point now of the pandemic where we can start having these conversations again. So, Caroline, absolutely wonderful to speak to you again. Can't believe it's been a year since our COVID care stories. But next time we meet, probably in one of our Lancashire meetings. But to everyone else, I will see you next week, hopefully with Mark Tops. If not, it will be myself and Mark Howe Senior from How To Training Consultancy. It's a mouthful, that. Anyway, good night, everybody. God bless.
Night, everybody.